So today we're going to be cool sculpting a client. As you can see, I have already outlined her and marked her up for her treatment area today of the lower abdomen. Prior to this, I did take pictures of her. So now that we're all ready for her actual treatment, we start by using the skin prep wipe, which is what I'll be doing first. And this is cold, and I always warn the patient, chilly. So I prep the skin for a good 30 to 60 seconds with the wipe in the treatment area. The Sharpie marker does come off a little bit. Skin prep, I will now be applying the gel pad. We will be doing what's called the Cool Advantage cycle on her. It's one of our regular size cycle. So it is, the purple will match the actual size of the applicator. As you can see, the gel pad is sticky and it is kind of a messy part of the treatment. Warn the patient this is cold, so here we go. So once I place it on the area that I prepped to be treated, I want to make sure and get all those air bubbles out. So I will make sure it's nice and smooth right over top of the treatment area where the applicator will fit. Okay, and now it's time for me to actually place the applicator. So what I will do is I will have the patient make sure that she's good and relaxed. I usually say, take a deep breath in and out, and just relax. While I'm placing this, the first thing you'll feel as soon as I get it in is you're gonna feel a tugging motion of your skin, and you will start to feel it being cold. So here we go. I go right over top. I wanna come right down on top of where the treatment area is going to be, where my outline is. So now during this part of the process, I have already attached the applicator to the patient's treatment area. I have secured it. We use a bobby pillow if need be. I put some towels around to make sure that it's good and secure and that she's comfortable. There's also times that we would use a strap if need be to make sure that the applicator does not move. So at this point in time, I've already reviewed with the patient some of the effects she would feel from having Coolsculpt during the procedure, and we also discussed aftercare too, things she may experience. So at this point in time, I just advise her to rest and relax. Okay, so I have removed the applicator from the treatment area where you can clearly see the area that I had marked before as what was treated. I took the gel pad off. I then grabbed one of our warm towels out of the towel warmer, and I will do a manual massage to the area. This does not feel very pleasant most of the time to the client, and I will warn them of this, but I only have to do this for about 60 seconds, and then I will retrieve to the Z-Wave machine that we have. Okay, so now this part of the treatment that we do here at Grandview is the actual Z-Wave treatment. The Z-Wave will take another 5 to 10% roughly of fat cells and destroy them through the radio pulse technology of the Z-Wave. To start, what I do is I place the Z-Wave lotion that we put on the treatment area. I have my settings set at the settings per Dr. Nanda's orders, and then I will go over the patient's area that was treated for 2,900 pulses, which takes about 2 to 3 minutes. This actually takes the place of that really harsh 2 to 3 minute manual massage that we do after Coolsculpting. I only had to do it for about 60 seconds, then we resort to this. So let's get started. Ready? I go back and forth over the treatment site, and I kind of do like a stitch pattern. And I already warned her that this for treatment today, I would usually have my clients come in around a week, and then we would actually use the Z-Wave machine on the areas that I treated again. We would evaluate them at a month. I will have them come in and I will take pictures in a month progress to see if we can notice anything or if the patients have any questions for me. And then from there we can also see if they need additional treatments to the area that we sculpted. And then after that, typically the clients will come back to me in their 90-day mark too.